Hello everyone, my name is Vânia and I'm a biomedical engineering master student from University of Coimbra in Portugal. I am currently doing my master thesis in a collaboration between University of Coimbra, Erasmus MC and KU Leuven. The title of my project is Glaucoma Prediction based on 3D-OCT Speckle Imaging. A little introduction to this problem. So, glaucoma is an irreversible disease and is the leading cause of irreversible blindness worldwide. However, the damage it provokes is preventable if it's treated at an early stage. So, for this reason, making an early diagnostic and close progression monitoring is crucial to prevent further development of the disease and prevent further consequences like blindness. The main characteristics of glaucoma are the thinning of the peripapillary retinal nerve fiber layer and the increase of intraocular pressure that is also linked to a retinal ganglion cell loss. So nowadays clinicians rely on mainly the retinal nerve fiber layer thickness and visual fields to identify glaucoma. So a big concern of glaucoma is that patients don't show any symptoms normally until a very late stage of the disease. So sometimes when it is diagnosed, there is already vision loss that could have been prevented if it was diagnosed earlier. So optical coherence tomography images have been the standard tool to analyze and identify relevant biomarkers for glaucoma, such as the retinal nerve fiber layer that I just mentioned. OCT is a low-coherence interferometry technique, and basically what happens during an OCT image acquisition is that an optical beam is directed at the retina or other tissue, and most of the light is scattered rather than directly reflected. So, because the light is scattered, it travels through different optical paths with different lengths until it reaches the image plane. So in the image plane, the intensity of each point will be the superposition of all the waves in that point. So there will happen constructive and destructive phenomenon, which will create a granular speckle pattern, which is a pattern that you can see here in these OCT images. You can see that there are darker and brighter spots. So that is called the speckle patterns. So what exactly is speckle and how should we treat it? So for a lot of years, speckle has been considered as a source of noise, so a drawback of all coherent light sources. However, that might not be the case, as it is proved that speckle can have a double role, as a source of noise, so signal-degrading speckle, but also as a carrier of information, so signal-carrying speckle. Many authors have considered speckle as only a source of noise, so they developed a lot of algorithms for speckle reduction or speckle attenuation. But if we consider the signal-carrying part of speckle, we can obtain information about the tissue microstructure. So instead of being just noise, it actually gives us more information than the one that is visible on the image. So for this reason, speckle analysis has many known useful biomedical applications that include hemodynamic analysis. Here you can see some examples of speckle patterns that were simulated with different speckle sizes. So as I said, these images were simulated using a mathematical algorithm, so they do represent an ideal case of a speckle pattern. So they are not from real data, but they are very useful to infer some speckle properties and to get an idea of how our models will perform when we apply them to real data. So here is a little outline of the different steps of my project, my master thesis project. The first step is speckle analysis. So learning different possible ways to extract information from speckle patterns. And for that, I performed a literature review on several different methods, which some of them I will present to you next. So second step is to gather all these features together with other clinically relevant data like age, the retinal nerve fiber layer thickness, microvascular density, and some other clinical parameters. And then the final and main goal of my project is to be able to implement a model for the prediction of glaucoma. There are several methods that have been developed for retrieving information from speckle. Here are just some possibilities that we will go into a little more detail next. So the first method I will be presenting is the spatial gray level dependence matrices. So these matrices measure the local variations in the brightness in a very small region of the image. So the way to calculate these matrices is by estimating the second-order joint probability distribution of each combination of gray level values that occur next to each other, average over different angles. So basically what all this means is that in the end we will have a matrix with the dimension corresponding to the number of gray levels in our image. So let's say we have an image normalized with L levels of gray. We will have an L times L matrix for each direction and for a given distance that we choose. So each element of this matrix, an element ij, is the probability of a pixel with gray level I being at a distance d from a pixel with gray level of j in the direction that we're using. So after having all these matrices calculated, we can calculate from them several features like energy, entropy, correlation, local homogeneity, and inertia. So these features can be used as features for classification model because they depend on the characteristics of the tissue. So another possible method is to use a discrete Fourier transform. So if we apply the transform to our image, we can divide the image into different regions according to its frequency distribution. So then we can calculate the percentage of the contribution of each different region to the total frequency magnitude of the image. This percentage can also be used as a feature in classification models, and basically what this feature represents is the percentage of information within a certain range of spatial frequencies in our image. And it's also very useful to distinguish between different tissues or even different layers in the same tissue. Another very common and very popular method is by analyzing the statistical properties of our image. So even though speckle formation is a random event, the signal intensities follow a certain probability distribution. So some examples of distributions that have been used to describe speckle data are the exponential, Rayleigh, gamma, generalized gamma, log normal, or Nakagami distribution. So this image here shows several distributions that were applied to the histogram of a corneal image. So in this case, if you look closely, it is quite clear that the generalized gamma distribution was the best fit, but that might not be the case for every tissue. Like different tissues may adjust better with a different distribution. So what is important about finding the best distribution for our case is that the parameters of each distribution will change accordingly to the tissue properties, so they are also very good features to use in a classification problem. One final method that can be used to infer information from speckle is the contrast ratio. So the contrast ratio is a property of an image that is defined as the ratio of the image's standard deviation to its mean. So by using this equation here, we can also calculate the local contrast, so the contrast over a localized spatial regions by using small neighborhoods. And so this contrast ratio value can also be used as a feature in, for example, segmentation problems, because the local contrast will change between layers of an image. But contrast is mainly used when there are moving scatters in our tissue, because there will be temporal changes in the patterns, and these changes may contain very important information about the motion of the particles in the tissue. So my project is still in progress, so it is not finished yet, but here are just some of the more important next steps for my project. So I will now extract features from speckle data, like with the methods I just presented here. And my main goal is, as I said before, is to develop a predictive model for the glaucoma based on discriminative event-based modeling. So this is a recently proposed method. The data that I will use to train this model will be of 614 subjects from the Leuven Eye Study cohort. That is a database that includes 2 different types of glaucoma patients, glaucoma suspects, and healthy controls. So thank you very much for your attention, and I hope you liked my presentation.